Hi, my name's Kate. I'm from Houston, Texas. I am here at Dr. Dugar's office about to receive my scarless rhinoplasty. I chose Dr. Dugar after doing a lot of research. This is something that I didn't just choose overnight. I've been looking into for years, and I chose him because his work, first of all, is exceptional, but his whole philosophy isn't to change your face or to put another nose or celebrity's nose on someone else's face. He takes your face and just kind of defines it a little bit more. And for me, I wanted my profile to be a little bit more feminine when I smile, and taking someone else's nose and putting it on my face, or showing a celebrity's nose and putting it on my face, it's more so my own face just feminized a little bit. The difference between an open rhinoplasty and scarless rhinoplasty from my research is that instead of making incisions or cuts on the outer surface of your nose, everything is happening on the inside, which makes it a lot more non-invasive. I want to see myself in just a more confident way, in a more confident skin. The physical changes that I would like to see in my nose is really just when I turn to the side, my profile, and when I smile, the tip kind of droops a little bit, and I would just like that to be a little bit more lifted, and just for the whole side profile to be more defined. I'm not sure technically what he needs to do that, but it's really just my profile. Head on, there's not too much that I want to do. I'm excited about my future, and I'm excited for, after the recovery this week, what the new level of confidence I feel like this is going to bring me. I'm really excited and optimistic about the procedure, and I trust him completely, so I'm ready for it.
So Kate has obviously a gorgeous nose, gorgeous face. She's a little strong in the profile. She's about 2 to 3 millimeters, a little stronger than we want. So what we're gonna do, shave down the cartilaginous profile, and then shave down the dorsal bony profile as well as lift up the tip just a tiny touch. We don't wanna lift it up too much. She has beautiful nostril tip complex, so we may soften the tip just about 5 to 10% here. And then if we need to, we may narrow the bones a touch. But the big goal of the surgery, of course, today is shaving down this cartilaginous and bony dorsal profile to give her the smoother contour and a little bit of an elegant curve that makes it look and feel as soft as her natural face. Kate's nose is the definition of why closed scarless rhinoplasty exists. When patients like her, who have beautiful nostril tip complexes, it should not be disturbed. Open rhinoplasty requires an external cut at the base of the nose, which requires reconstruction of the entire nose. It's necessary for people who have really bad noses, people who have severe asymmetries, or people who really need reconstruction after a bad previous surgery. But for someone like Kate, who's never had surgery before, and that's someone like you as well watching this, understand the importance of closed scarless rhinoplasty. Now, looking at Kate's anatomy, the important thing to notice is the strength of her nose comes, as you see, on her dorsum. Her side profile is where the strength is. From the frontal view of her nose, she's gorgeous. You would almost say she doesn't need anything, and that's absolutely correct, and that's the beauty and the art of closed scarless rhinoplasty. And we're going to take you through the journey today of exactly what we're going to do with Kate's nose. Step 1, local anesthesia. This is where we inject local anesthetic medication into Kate's nose before we begin surgery. This allows it to be painless, but more importantly, almost bloodless. Step 2, lifting the tip of the nose. We are now shaving the caudal edge of the septum, as well as cutting the depressor nasi muscle. This will prevent Kate's nose from rotating downward as much when she smiles, so the tip never looks droopy. Step 3, we're now making intracartilaginous incision to address the tip of the nose. Kate has a beautiful tip, so we don't want to change the overall architecture, we just want to debulk it by about 5 to 10%. So we are going to remove a small sliver of cephalic trim of cartilage from both sides of her tip, as you see here. Step 4, we're now accessing the cartilaginous and dorsal bony profile through our intracartilaginous incisions. We're skeletonizing the nose to allow us access to see the dorsum, where now most of the work will be done. Here we're shaving the cartilaginous profile and showing the removed segments of cartilage and how we now have to go up to the bony segment next. Now we show the removal of the bony segment of cartilage, and we've removed the bony and cartilaginous segments to allow the softer contour to her natural profile. Here we show the comparison before and after of her natural before and after once we've now addressed the cartilaginous and bony parts of her septum, addressing the bony dorsal hump. Now we're moving to the narrowing of the bones. So here we narrow the dorsal by narrowing the nasal bones to reconstruct the nasal pyramid. Here we show the before and after narrowing the nasal bones. Lastly, we close up all of our incisions, which are all inside the nose, no external cuts or scars. And now we're placing the cast and the tape to let the nose be compressed for 1 week. After 1 week, when the cast comes off, there should be little to no swelling on the nose, and hopefully, fingers crossed, little to no bruising. Now, after we finish with the case, Kate's nose looks amazing and fantastic. I'm so excited for you guys to continue watching and see what it looks like in 1 week.
Okay, I did it. I received my scarless rhinoplasty today with Dr. Dugar. Yes, I'm aware I look a little crazy right now. Of all of it is just being kind of stuffy, but that's it. Zero pain. Like, this has been practically painless, this whole process. All of this looks really gnarly, but I am in zero pain. My week was surprisingly so easy. I was just telling Dr. Dugar I've waited so long for this surgery because of what I've heard of the recovery, and I've just been putting it off, and it was nothing compared to what I heard in the past. So that was super shocking. I was only taking my pain medication the first day and had half of one the second day, and that was it. Like, that was all the pain meds that I needed. My ice and did Tylenol, and that was about it for recovery. So it was super easy compared to what I was originally expecting from a rhinoplasty. I am looking forward to doing the same day-to-day things that I've always done, just in a more confident way and feeling in a better version of myself. So I don't plan to change anything, I just plan to feel a little bit differently. I am so excited for the final reveal. I know 7 days doesn't seem like a lot, but I don't know, this is like one of the biggest decisions that I've made in my life. I'm so excited about it. So yes, I'm excited about the final reveal. So good.
Ready?
Oh my gosh, so much better. Oh my gosh. Oh my gosh. I cannot believe it's like my nose but better.
Yeah.
You know?
Mm-hmm. It's gonna get even softer. The side profile's gonna get even softer.
Oh my god.
All that's gonna keep coming in. It's gonna be really nice and soft.
Oh, I love you. Thank you so much. This is crazy. I can't stop looking at it. Like, this was years of like insecurity, you know? Thank you. Like,
Come over here. Take a look in this mirror. This one's fine.
okay. Oh my god,
Everything up.
I just feel softer, you know?
Yeah.
I don't feel like, I don't know. I don't have to contour my nose anymore. And it doesn't droop when I smile.
That's right.
It stays. I could cry. I'm really just holding it back right now.
I love it. Congratulations.
Thank you so
You're welcome.
much.
Congratulations. Looks so good.
I'm so happy. Hey guys, so it has officially been 2 months since my scarless rhinoplasty. It doesn't feel like 2 months at all. Time has flown by, you guys. It has flown by. The recovery is so easy. You kind of just transition back into your normal routine so shortly after that it doesn't feel like you're in recovery anymore. This is 2 months post-op. That is my new profile. Thank you so much, Dr. Dugar. I am